of the groups that experience a lack of opportunity to get their kids vaccinated on time are Aboriginal and Torres Strait Islander communities. And here we're looking at issues around access to health services that may not be culturally respectful and put people off going. There may be issues of families having many other priorities in life to deal with, families living in poverty, families having transport problems. So it's often around practical factors that affect those families. The good news with Aboriginal and Torres Strait Islander children is that although their immunisation rates are lower at 12 months, they tend to catch up by 2 years of age, and they're pretty similar. They're around 92% at 2 years of age, which is the same as non-Indigenous children in Australia. So in a way, that's kind of a success story that we often don't hear about with Aboriginal and Torres Strait Islander communities, that there are some good things that are being done and there are some things that are quite successful. And in Australia, we have hepatitis B vaccination rates that are higher in Aboriginal children than non-Aboriginal children. So not only are we closing the gap there, but we're creating a new gap, which is kind of good in a way, because we're finally redressing some of those inequalities that they've lived under for so long. Well, I mean, often we think, if we just educate people, we'll do a campaign and they'll get immunised on time. And that's really important. Campaigns are really important for putting that message out there. But if you don't have a car, or if you're homebound, or if you live in a remote community and you missed the last immunisation nurse visit, then it's really hard to get your kid immunised on time fully. And there are a lot of vaccine visits that parents are required to go to as well. So it's important to acknowledge that barriers to access are really important and can be major problems in vaccination uptake, and no amount of campaigning will alone address that problem. And the same goes for, so in Australia we have slightly lower immunisation rates, not among culturally, linguistically diverse communities generally, but where the child is born overseas and they've started off on a different schedule. Then they come to Australia and they may need to catch up with a whole lot of vaccines that weren't available to them in their home country. And so that catch-up period takes a while, and that's where you see low vaccination rates until they're fully caught up, and sometimes they don't catch up. So it's really important that the health services look out for those children when they see them and opportunistically ask if the children are vaccinated. And if not, plan a catch-up schedule with them. And services need to keep doing that. All the services, the hospitals, the emergency departments, the primary care providers, all need to be asking those questions about whether that child is up to date with vaccination. And if they do that, they can make a real difference.